Welcome to Massey Dialogues. My name is Upasana Saha. I'm a third-year PhD student in health economics at the Institute for Health Policy Management and Evaluation at the University of Toronto. I'm also a Massey Junior Fellow, and I'll be your host for today's dialogue. Massey College is a place for ideas. Its mission is to nourish learning and to serve the public good. The physical Massey College is built on Indigenous land, the cherished land of the Huron-Wendat, the Seneca, and the Mississauga of the Credit. We're very grateful for their stewardship of the land and also to have the ability for Massey to continue its work. The Massey College community is based on the idea that in order to truly serve the public good, we need to build bridges between cultures, between disciplines, and between generations. The Massey Dialogues are designed to embrace the very essence of our college and our community. Today, we'll be speaking about global health, and in particular, the response and the impact of the COVID-19 pandemic within the context of global health. Joining us are three very distinguished leaders known for their service around the world, starting with Dr. James Orbinski. He is the professor and the inaugural director of York University's Dadelet Institute for Global Health Research. To name a few of his accomplishments, James is a medical director, a humanitarian practitioner, an advocate, a best-selling author of his book, The Imperfect Offering, and a past international president of Médecins Sans Frontières, MSF, from 1998 to 2001, during which time he accepted the Nobel Peace Prize on behalf of MSF. And he is no stranger to Massey. Next, we have Dr. Peter Singer. He's a special advisor to the Director General of the World Health Organization and the Assistant Director General of the World Health Organization. Previous to this, Peter was the CEO of Grand Challenges Canada for over 10 years, and also he was the director of the University of Toronto's Joint Centre for Bioethics. And thank you for joining us all the way from Geneva.
Thank you.
Yeah. And then we have Joanne Liu, Dr. Joanne Liu. She began her work with MSF doing field work in 1996 and was the international president of MSF for 2 terms from 2013 to 2019. During which time she led the response for the Ebola pandemic. She is a physician specializing in pediatric emergency medicine and is an associate professor at the University of Montreal and professor in practice at McGill. Thank you so much for joining us, Joanne.
Thank you.
So the three of you have tremendous previous leadership experience in different segments of global health. Can you tell me, starting perhaps with Joanne, of where you are taking, your 25 years of experience in pandemic preparedness, including response to Ebola, and how you have applied it to the work, and perhaps you can focus on the work that you've done in the province of Quebec.
Well, thank you very much for the question. I think that it's a bit of an odd question for me to answer because I've only been back for a few weeks, and I think that what is quite interesting is to move from a position of power and means through an NGO to becoming a sort of a label expert with know-how but no power. So that's a bit of a transition, and it's a very humbling exercise. And for the time being, it's really hard to make people hear when you are not into the system. To make them understand what will be your added value when you are already in a dynamic of systems in silo or not, and you're just like the newcomer. So very, very challenging and very humbling. So I guess that's all I can say for now.
Thank you for that, Peter. So you're in Geneva right now, and you have a very special role as the advisor to the Director General of the World Health Organization. Can you speak to us a bit about where you're focusing your efforts? And I know that there's a lot of work going on, of course, to support the response for COVID-19.
Sure. First, let me say what a privilege it is to be with Massey. I've been associated for a long time, and to be here with 2 people I really admire, James and Joanne, the only 2 Canadian international presidents of MSF. It's a real privilege for me. I came to Geneva to work at the World Health Organization 3 years ago at the request of Dr. Tedros, the Director General, when he started. And I work as his special advisor. I support him really in helping him develop a results-based organization focused on results at the country level. Our triple billion target in universal health coverage, health emergencies, healthier populations. And of course, during COVID, we're all focused on that, working night and day and around the clock. And I feel very humbled and proud of colleagues and of the leadership of Dr. Tedros. And my job really has been to support him.
That's great. James, you have, through the Data Lake Institute for Global Health Research, there is a COVID-19 portal which is updated very regularly with the latest data and the policies. Can you tell us a bit about what you see as a future of the portal and what you hope to drive through this?
Yeah, so also, like Peter, just let me say how pleased I am to be part of the Massey Dialogues. It's a great community, and what I love about the college itself is its commitment to the common good and to the public good, and to bringing to bear the best of academia, the best of the private sector, and the best of the public sector in an open collegial space where that public good can be pursued. It's always been the great value to me of Massey, and it's wonderful to see that at least over my many years of affiliation with the college, that's even stronger now than it was when I first started at the college. And it's also a great pleasure and privilege to be here with Peter, a longtime friend and colleague, and the same with Joanne, also a longtime friend and colleague. We have many shared perspectives, but we also have many different perspectives, and we're not afraid to mix it up. So please don't hesitate to provoke us into saying or pursuing issues that are slightly contentious. So to answer your question directly, the COVID portal that we have launched at the Data Lake Institute for Global Health Research at York, we started the portal in mid-March, and it was really an effort to try to focus attention on the global health and on the humanitarian issues that were emerging and are still emerging very much now a major issue around the COVID pandemic. And really what we tried to do was frame the knowledge and the unfolding reality of the pandemic in a very clinical and practical and policy-oriented way. And so we look at the state of the pandemic on a daily basis. We look at clinical public health issues. We look at water and sanitation and prevention and control issues, equity and protection, and then finally access to healthcare technologies and research. And so the effort really is to constantly curate, if you will, the best of knowledge and to put it in that framework.
Okay. And oftentimes the response to a pandemic or the dissemination of support in different regions relies on the data that you have coming in from the ground. And if we know that there is imperfect access to testing and diagnosis data, especially for COVID-19, what have you, James, maybe we'll continue with you, kind of put in place to understand that there is imperfect data coming in, but there are certain mitigation plans that you can also implement to support in that?
Well, so, I mean, the answer is in your question, really. And I think that what we have tried to do with this portal is, as an academic institution, is to curate and frame knowledge, and at the same time do so with a very clear and explicit recognition of, first of all, the imperfection of knowledge, and secondly, the unfolding nature of new knowledge. The other is that, I just want to be very clear that we look at many, many sources of information, and probably the single most important and the single most reliable and practical source of information is the WHO's website. It's very different than ours, but in terms of what it does and what it seeks to do, it's probably the best in the world, and it's far better than what I had seen, in the 90s and the early part of the 21st century. The WHO, in terms of its practicality and its focus on practical policy and tools, has really come a long way. And I would urge anyone who's interested in the practical issues to look at two websites. One, mine, and the other, the WHO website.
Yeah. And Peter, do you mind just commenting a bit on that same issue, understanding there's so many different inputs coming in and there might be gaps in the inputs that are filtering through. How do you sort through them, especially from the perspective of the World Health Organization?
Yeah, thank you. I mean, first to frame where we are in the pandemic, if you went to the WHO website, as James was talking about today, you'd see there were 6.2 million confirmed cases and 376,000 deaths, with the pandemic still rising. Mm-hmm. So this is one of the worst public health crises probably in a century, mm-hmm. and we're at the beginning stages of it. I think that's important framing for people to recognize. Maybe the way I'll answer your question is just to say that in the midst of a pandemic, in the midst of any crisis, what's called the infodemic can really cause problems. Misinformation, false information, information that's not evidence-based, information that's not science-based. So WHO has worked hard to put, for example, Mythbusters on its website, etc. But maybe more importantly, we've worked with almost all the major social media companies around the world to point them to reliable sources of information. So when you go on Facebook, on Twitter, on TikTok, on many different social media platforms, you're likely to be directed to the WHO website or to reliable sources of information, which I think is implicit in your question, Upasana, and a very important piece, because false information can travel as quickly as the virus and it can cause real harm. And one of the things WHO has done in this pandemic is really zero in on that and work closely with social media companies to try and address it.
Okay. And maybe I want to shift a little bit from the information to what else is out there, because understanding there needs to be rapid and fulsome response to COVID-19, but there are other existing global health priorities that exist. The burden of other diseases still remain. Natural disasters happen, conflicts are still present and will happen in the future as well. And so how does a large organization like World Health Organization, MSF, and other multilateral organizations understand and set priorities, understanding that there is COVID-19, but then we have all these other things that are happening as well? Peter,
sorry?
Peter, we'll start with you.
Yeah, sure. Thank you. So, I mean, I think maybe it's important for people to realize there's sadly three ways, at least, that you can die from COVID. One is directly to be infected, and I talked about the 376,000 deaths as of today, June 2nd. Secondly is indirectly from lack of access to health services. Maybe you're afraid to go to the hospital. Maybe the health services are unavailable. And that's a huge problem. So 8 million children under 1 have their immunization affected. A recent survey showed that more than 50% of countries have partial or full interruption of their hypertension, their blood pressure treatment programs, and so on. And just this week, very unfortunately, a second Ebola epidemic came up in the western part of DRC. So the risk of not being able to access health services, the risk of other types of outbreaks, measles as well, really can cause a very, very significant amount of uncounted deaths, let's say collateral damage. That's the second way. And then the third way is that poverty kills. COVID is something that affects lives and livelihoods. And if you depend on work for your daily bread, if you are in a lockdown and you can't work, then possibly you can't eat. This also affects migrant communities. And the cascading effects of COVID in terms of human death and human suffering are huge. And I just wanted to paint that whole picture, which I'm sure James and Joanne will also zero in on. in terms of the crisis that we face. It's a crisis of lives. It's a crisis of livelihoods.
Yeah. And Joanne, I know that there was a lot of work that you were doing and with the MSF on polio and measles vaccine. Can you talk a bit about what practical implications that's had on MSF's inability to vaccinate the targeted populations?
Yeah, I think I would not answer that question because we don't really do that kind of immunization. But I'd like to go back to the question you asked, Peter, and it's how do we prioritize things? And I think that it's important, that it's always a balance between what is the urgency, what added value are you bringing as an organization, what means do you have, and is there access to the population you want to help? And then it's this is how you figure this out. With respect to what we're living right now with COVID-19 is with the travel bans and the visa issue. Actually, international organizations are quite actually grounded right now, and it has affected a fair amount of international program overseas. And you can look at different organizations, but for MSF, there's few, I would say, key mission that are being closing or downsizing. So it's huge. It's a reality. And so it is part of within the balance of how we pick priorities. In addition, COVID-19 brought the other dimension is we are working in the high income country, and in some countries we've never had to work before because there's a know-how about pandemic from MSF as an organization. And they were vulnerable population that were sort of overlooked or in the blind spots of rich nation. And then we can talk about the long-term care facilities, we can talk about the prisons, we can talk about the migrants. And so it's quite astonishing that we work in several different hospital or vulnerable population environment in Spain, in Italy, in Greece, in France, in Germany, in Canada, in US, and we have at least a dozen high-income country. That's what we are witnessing right now as an organization. So I'm not leading the organization, but I see what they're doing, and then I've been involved in Canada to try to contribute to facilitate some of those actions. So the priority setting is a mixture of. It's not only looking at the urgency in isolation, but it's part of an ecosystem, and then you have to make a decision in that ecosystem in terms of making a difference, bringing value, having a real impact.
Right. Do you also see that it fosters perhaps an environment of innovation when there are certain limitations, for example, travel limitations that are placed on organizations like MSF to actually move their people from one place to another? Do you think innovation can happen?
Well, I think it's innovation, but I think what is great is we've been dragging our feet about localization of aid, and I think that COVID-19 will fast track localization. We always know that the first response is localization, but I think it will help us to decolonize the humanitarian aid somehow, because now we cannot move, and people are doing actually fairly well. So I think that what our duty now is to make sure that they will be able to respond with the right means. And it's untrue that the low and middle income country will be able to face COVID-19 with only soap and pamphlet. They're going to need a little bit more. Right. And in that, the WHO is helping to making sure that we get, some PPE, but we have to be as well realistic.
Right. And James, do you see this shift towards localization happening sooner rather than later? Is there anything in the readings and the reports that have been coming through to kind of resonate with that?
Well, yes. So, for example, I have a long-standing research program in Malawi on HIV, TB, and on the health impacts of climate change. And so, I'm there regularly, and I have a deep kind of set of friendships and relationships there. And so I have a pretty good sense of how that particular country is responding. So I think it's true that some of the things that you're saying are true, that for example, there is more quote unquote innovation. There is more reliance on what people call local partners, and so on. But there's also more reliance on outside expertise, because the long-standing incapacity that has existed in much of the developing world, and the long-standing lack of support for the development of true competent institutional strength, that has not evaporated. We have to be very careful, that we are quite mindful of not letting shiny baubles like innovation seem like they're just the latest and greatest thing in the world. Yes, there are many good things. There's a digital shift to a digital platform for understanding and delivering many aspects of healthcare. Those are all good things. There's all kinds of innovations around creating interdigitated research platforms for drugs, diagnostics, vaccines. These are all really good things. But the long-standing inequities that have existed for a very, very long time are illuminated and exacerbated by COVID. And the other thing I would say is that it's very easy, especially when we from our comfort in an OECD country, it's very easy to sort of see the world as kind of predictable, mechanistic. It can be modeled. There's a positivist kind of worldview, but the world and the reality of human interaction is it's political. There are political forces at play that aren't necessarily rational, that aren't necessarily predictable in the pure scientific way that we would like. The world is not necessarily this perfectly mapped mechanism where you can identify a deficit and then add an aliquot of resource. The fact is that in countries like Malawi, the impact of COVID is devastating, and the interventions that were proposed early on, i.e., lockdowns, were protested, and there were literally riots in the streets of Malawi. And it wasn't the only place in the world where this happened, because people said we'd rather die of COVID than starvation, right? And so the kind of issues that Peter identified, the not secondary but tertiary impacts of, for example, poverty on people's ability to survive and thrive. This is absolutely front and center. And what COVID does is what it has done is illuminate and exacerbate, and our response to COVID in many ways has exacerbated inequity. And there are efforts, strong efforts, to try to be sure to do all that we can to make sure that whatever interventions are garnered, that they increase equity as opposed to decrease equity. And just as a matter of principle. So I just sort of caution that we don't, oversimplify the complexity and the dynamic nature of our world.
Okay. And Peter, oftentimes understanding that there are so many nuances to an approach, and it has to be very much targeted to the country that you're focusing on, the World Health Organization, for example, doesn't operate alone. It is large. There's interdependent systems. There's multilateral institutions, the WHO, there's United Nations, there's even MSF to an extent, and other organizations that exist. They have to coordinate, they have to assemble, they have to disassemble to rapidly respond to a pandemic. And so the governance structures that you currently see, do they need to change? Is there any adaptation that needs to happen? Or is the structure agile enough to kind of continue moving forward?
Well, a few thoughts. Firstly, the World Health Organization is an organization with a large country footprint that supports many governments around the world. It has 149 country offices, has had more than 80 surge missions supporting governments. On the innovation side, innovation's important, vaccine's important. There's more than 200 vaccine candidates in the pipeline with about 10 in human trials. But what's at least as important is what James said about equitable distribution. And down the line, highly effective therapeutics, diagnostics, also very helpful. So innovation and equity are both hugely important. To your question on multilateralism, I think the multilateral system is something that has been tested by COVID. I think in the response to a pandemic, WHO is at the heart of that system. And I think it's responded in the ways we've been discussing on the infodemic, on the support to countries, shipping personal protective equipment, oxygen, diagnostics to more than 100 countries, the access to COVID tools accelerator to help accelerate equitable access to a vaccine. So I think the multilateral system has responded, and it's responded as a system with the humanitarian piece and with many partnerships on supply chain with World Food Program, with UNICEF, et cetera. So I think the system itself has responded in support of governments. And maybe the last point I'd like to make here is a hat tip to Canada. You know, Canada has a long history of support for multilateralism. And in the context of COVID, there's been strong support, particularly to the humanitarian aspect. So, for example, today there was a pledging conference on Yemen, which is one of the worst humanitarian crises in the world, where potentially up to half the population will be infected with COVID as it goes through the population. And Canada pledged, I think, $40 million in the humanitarian context, and it's been consistently supporting that, as well as immunization, as well as the access to COVID tools accelerators. So the multilateral system is extremely important. COVID is a global challenge. It can only be subject to a global solution. That means the multilateral system has an important role to play. And at the heart of that multilateral system in the context of a pandemic is the World Health Organization.
Yeah. Joanne, do you agree with Peter in terms of the nature of multilateral institutions and the approach that they've taken, particularly with the COVID-19 pandemic?
I don't think I will answer if I agree or do not agree, but I think I will add a few things.
Yeah.
I think that COVID-19 has been will be and is an amazing journey as us, as humanity, and it's really putting multilateralism under stress, and are we performing well? Well, I think after that we're going to need to just sit and reflect, and are we going to fix a few things, because it is clear that what COVID-19 has put under the spotlight is that we're so interconnected and interdependent in a very complex way. And then we cannot pretend now that when something happened at the other end of the planet, will not come and knock at our door and challenge us and threaten us. So that is great, because I think everything that we tried to say in 2014, 2015 after Ebola, and how we were trying to implement the global health security agenda, did not really fly because people could not see that interconnectivity in a real way. So I think that is important, but I think that we fell short on some what I call international platform. I think that some of those platforms, like the different G7, G20, G77, what I call the like-minded country club group, fail, to react in a timely fashion. I believe as well that the European Union did not, step to the plate as a group, 28 countries as a group, to just say, how can we help each other when we're short of everything? And is the only answer closing borders? It was part of the answer, but was not probably only the answer. And it was fascinating to see that the solidarity mechanism between countries was not the strongest. And I think that even in Canada, if you want to take it, locally, I think it's been challenging. And I've been sitting on few expert panel group here, and then at one point people were saying, oh, well, we should not expect that if we have X amount of ventilator, that another province will lend it to another province. And I lost it during the meeting. I just said, are you kidding me? I said, why are we a country?
Right.
If we not willing to help each other between provinces, get real. I do expect that, we're going to help each other. Otherwise, there's no point to be a country. Yeah. So it's this that we're going to think of how we're going to be able next time around to hit the solidarity mechanisms much earlier on, and not having to put people under pressure. And I will say something on the WHO because Peter has been such a gentleman, but I think I find it fascinating that in a time that we are responding to the pandemic of the probably of the century until now at least, that some countries are pulling their funds away from the WHO. And I always say, it is as if, me, I'm in my crash room, and one board of director will come in my ER when I'm trying to intubate a patient and will cut the oxygen flow. And I will say, hey man, I'm trying to save a life.
Yeah.
And I think that this is where, there's something broken about how we conceive our multilateralism and how we allow those kind of events to happen. There will be time to settle account. There will be time of accountability. No one is perfect. This is uncharted water, and so we need to let a breathing space for people and for agencies.
And maybe I'll continue on and I think what you've said is so important. Solidarity, it's very much needed, especially in such moments of crisis. And when you have a large entity like the U.S. withdrawing almost $400 million of funding that they provide to the WHO, how do other countries step in? Is it like, do other leaders show by example, or is there a group that needs to be formed to kind of push this forward? What would you suggest?
Well, I think that there's something to say about the country decided to pull funds, but then I think there's something to say about other countries to stepping up to the plate, to double up, triple up, their bid on the WHO. And this is what should happen. And I do hope, that our country, will respond to that call.
Yeah. James, I know that in one of the previous Massey dialogues, you did speak a lot about perhaps a new strategy for multilateral institutions. Do you have any further comments, perhaps about solidarity that Joanne has spoken about?
Well, I think what I would say is we've never needed multilateral institutions more than we need them today. That's around COVID, whether it's around climate change, whether it's around the fragility of the international financial architecture and global economy. There's absolutely no question in terms of risk, complex interdependency, in terms of the way risks flow together or cascade. then compound, making one worse than the other, and then ramify, if you will, in unexpected ways that we just didn't anticipate.
Mm-hmm.
It's only through institutions or through fora, but institutions are always better than fora. I shouldn't say always, but often better than fora, to deal with problems or challenges of the global commons. And our issues now, I've just touched on 3 broad categories, are literally compounding one on top of the other. And yet multilateralism is not a given. And we have to remember that the multilateral institutions that we now have only came into existence after World War II. And they came into existence because of World War II, and because of World War I, and because of the interwar period, and the consequences, the human lived consequences of really a 50-year, almost 50-year period of near constant warfare. We recognized through our lived experience as human beings, the necessity of competent institutions. And it was very much the Americans with their allies, but very much the leadership of the Americans that created the United Nations system, the Bretton Woods institutions, the World Bank and the IMF, for example. And it was very much the Americans who led the reform to the global trade system, from GATT to the WTO. But now it is the Americans who are walking away from that system, from not just the trade system. They're certainly making the strong effort to walk away from the WTO, World Trade Organization. They have walked away from the Paris Agreement on climate change. And there is now, the banter, if you will, on the street, on K Street in Washington, the policy sort of space where the various lobbyists talk. The banter now in Washington is about, should America just pull out completely of the international multilateral system. And the WTO, the WHO, the World Health Organization, is the latest victim, if you will, of the current thinking and the current trends within the political leadership and establishment of the United States. Now, that's very serious, very, very serious. And what it does is it, in my mind, it pushes virtually every other member of the global community to shore up and ensure the viability of our multilateral institutions, and not without a constant attention to improving those institutions. But Ireland, for example, quadrupled its support for the WHO when Mr. Trump made his first threat that he was going to withdraw from the WHO. The EU, Germany, France, and many other countries, the Scandinavian countries, for example, all made public declarations in support of the WHO, including Canada, by the way. So, this is a time where a major country, the United States, is toying with the idea of moving away from our multilateral system. And this, therefore, must be the time where virtually every other country supports that system. It's very much in our wise self-interest to do so.
And so we have a few questions from our audience. And thank you. Firstly, I want to thank you, James, for kind of providing that I think there's a lot to be learned from history. And I think it's important to kind of look back sometimes to look forward as well. We have a question coming in from Pankaj Mira. The question is, how are you working around the challenges arising from prevailing environment of populist politics to continue providing cohesive support globally and locally? Perhaps we'll start with Peter for that one. I think there's a lot to unpack in that particular question, but I'll let you first take a stab at it.
Well, it's a bit of a continuation of the conversation we were just having. And maybe what I'll say about that is that from the very beginning of the epidemic, Dr. Tedros has called for global solidarity.
Yeah.
based on national unity, and actually based on individual humility as well. And that's really been his call. I want to pick up on one thing James and Joanne mentioned, just to fully agree with them about the idea of a review of the international response after the international response. That happens after every major outbreak. There's always lessons to learn. No institution is perfect. It was actually in a resolution that all the health ministers of the world passed about 2 weeks ago at the World Health Assembly, which we held virtually. And I just wanted to fully agree with that.
Yeah. And speaking of new contracts or updating contracts, there was an updated contract with the World Health Organization, the UN Refugee Agency, to support the ongoing efforts to protect displaced people around the world, especially from COVID-19. And, you know, building on the topic of there's nothing like a crisis to really magnify the gaps that really truly exist. Peter, do you see potentially the pattern of people migrating, asylum seekers and refugees moving to host countries because of the current pandemic? Do you foresee any changes in their livelihoods and the patterns of how they access the host country?
Yes, and 70 million forcibly displaced people around the world. It's a terrible tragedy. Maybe the point I'll make here, and would love to hear James and Joanne on this because they have such deep experience. It's always the most vulnerable that suffer the most, and that's really the point that I would like to make. The more vulnerable you are, the more likely you are to suffer from COVID. And the world's most vulnerable people are in humanitarian crises, are migrants and refugees. And we're at the beginning of the pandemic. The worst may be yet to come. The most vulnerable will suffer the most. That's a global challenge that requires a global response. And that's what we are 100% focused on day and night, is saving the lives of the most vulnerable. And that truly is the focus of the multilateral system, the United Nations, and of WHO. And I'm sure that Joanne and James will want to add on that particular very, very important issue that you raised.
Yeah. Joanne, we'll come to you next if you wanted to speak to that as well.
Well, I think that it's quite interesting what's going on with the people in forced displacement. And one of the things that we have witnessed in many places, he basically gave a blank check to close borders. And that's what we're seeing. People are being pushed back across Europe, and right now there's almost no more crossing across the Mediterranean Sea. So now things that in the past people were being criticized, now they have the perfect excuse to close borders and stop doing any process of asylum seeker. To take an example that is much closer to us is if you look at the border of Mexico and the U.S., they basically right now when people are coming because of the environment where they are kept in detention, they had to decide between the least evil is to keep them and try to go to process, knowing that most of the tribunal are closed right now because of COVID-19, and knowing as well the living condition, or sending them back with no process. And basically the recommendation, because one of the rules that people are aiming for, and I have sympathy for that, is it's like no children, nobody should die under the custody of the U.S. So basically now what do is people arrive and they put them back in a bus and send them to Mexico, where right now right now COVID-19 is hitting hard. Mm-hmm. So it is very, very I would say concerning, and they will take the heat of COVID-19, and they probably would take it out of the spotlight because we're not able to reach them. We don't know where they hide, or not hiding, or where they are trying to find shelter. But I think it's going to be something that we will never have a full grasp about it. And then as well, everybody's so much inward looking right now that there's only the international agency, NGOs, that are basically tackling the issue. So deeply concerned, absolutely deeply concerned.
Yeah. And it almost becomes this overwhelmingness to it all, because there is that particular crisis that has existed prior to the pandemic, and there's so many different aspects associated with it. And then you layer on this pandemic, which has so many factors to it. James, maybe you want to comment a bit about the asylum seekers and refugee and the change that you foresee moving forward.
Yeah, I just I agree with what Peter has said and what Joanna said. Just maybe just put some numbers to that. There's 165 million people today who need humanitarian assistance of some kind around the world. That's a lot of people. That's more than at any time since World War II. The funding to the UN humanitarian agencies, never mind the private funding and the private fundraising of organizations like MSF and CARE and others. The funding for UN agencies has relative to the increase in demand, the funding has been going like this, has been going down. And the gap between the supply and the demand for funding has been growing. Now there's about a 51% gap, right? And that's been growing over the last 15 years. As well, there has been a systematic effort to water down refugee law, international refugee law, and the rights and responsibilities of states toward asylum seekers. There has been a systematic effort to water down those responsibilities over the last 8 years. And now, in the face of COVID, exactly the kind of thing that Joanne very eloquently described. This is the new reality, and the most frightening dimension of that is exactly what she said. It will be silent and faceless. We will not see it, and therefore the probability, the risk of abuse, of even greater abuse, is much, much higher. And the last thing I'll just say is that, just to go all the way back to what Peter talked about, the primary, the secondary, and the tertiary effects or mortalities associated with COVID. The OCHA, the Office for the Coordination of Humanitarian Affairs, has said very clearly, based on very good analysis, very good evidence, that if unaddressed, COVID could affect, in fact, 44 million people in Africa alone by the end of this year. If not properly addressed, we could see up to 250 million people who suffer from famine and profound food insecurity by the end of this year. The Secretary General of the United Nations is calling this threat, this risk, a threat of biblical proportions. Now, these are, what we need now in the face of the kind of populism that has emerged around in many parts of the world, and that is driving a lack of response, a lack of systematic response to the realities that we're all talking about here. What we need is political vision and political leadership. And it's not simply the responsibility of politicians to play that role. It's the responsibility of leaders of organizations like WHO, deputy directors of organizations like Peter Singer, who is playing his role, leaders of organizations like MSF to play their role. And Joanne, for example, as a former leader, is playing her role. So, and it also requires that citizens engage in their political process, not just domestically, but the politics of their country, of Canada, for example, internationally. So this is what our new reality requires. It requires not that we retreat and feel overwhelmed by the bigness of the problem, but that we engage. right? That we seek to participate in shaping the world around us so that it is truly more fair, more just, more equitable. It's only by doing. There's no other way. It doesn't happen by magic. It doesn't happen by dreams. It happens by what we do.
Yeah.
Upasana, before we get to the question of my friend Anita McGon that I see there on the screen, could I just add in 30 seconds that another thing individuals can do, and I really say this with a lot of humility, and I've done this myself, is to contribute to the Solidarity Fund, which 389,000 people have, $215 million has been raised. And to your point on humanitarian, WHO and UNHCR refreshed their agreement a couple weeks ago, and $10 million was transferred from that fund to UNHCR in support of its humanitarian work. It's through the UN Foundation in New York, but in Canada, the KBF Foundation will issue a charitable receipt. And I'm not here to sell things, but I think since we're on that topic, since we're talking about what individuals can do, since we're talking about what how we can help on humanitarian issues, and since I've actually done it myself, I would just mention that in case any of your viewers are interested.
Of course, very important. We'll move on to Anita McGowan, which I'm sure all three of our speakers know really well. And her question is, what kind of structural change in institutions do we need to achieve the multilateral impact that you envision, to see the multilateral impact that you envision? How do we fix the structure to support the most vulnerable most effectively? Joanne, we'll start with you.
I think I'll go last. I need to think.
No worries. And James, I'll go to you first.
Well, I would say, it's first of all, I don't want to sort of throw out a couple of simple recipes and have that be the kind of prescription. I think there's some basic principles that are really important. Number one is to our existing system is transparency and accountability. This is absolutely vital to trust in those institutions in the future. So the kind of things that we've been talking about here, we have a pandemic, and yes, the overall response of, for example, the WHO has been quite good, I think, but not perfect. And nobody expects it to be perfect. But nobody in a position of responsibility and public responsibility would simply sit back and say, oh, well, that's good enough. It's never good enough. It can always be better. And that's why there is a commitment passed by the World Health Assembly to a review, to an ongoing open review. And this is not a new thing. This is a part of effective institutional structure and function. Accountability and transparency are vital to trust. That's the first thing. The second thing I would say, and to competence, trust in the institution and to the competence of the institution. And then the second thing I would say is that institutions don't function on hot air. They function and require resources. They require money. And in order to be able to attract and retain the best people in the world, in order to be able to have the operational competence to respond immediately, and that money can't be based on charity. It can't be based on, well, I feel like giving it, I don't feel like giving it. Oh, if you do what I like, will I give you $1, or maybe I'll give you $1.25. It has to be mandatory. The funding for major multilateral institutions must be mandatory. And there must also be a backstop, an appropriate financial management of those resources, so that if there is a crisis that is apparently overwhelming, there are sufficient resources or sufficient backstop mechanisms in place to allow the institution not only to maintain its minimal function, but to surge to address whatever issue that crisis defines for it. And I think those are really, embedded in those comments are a whole bunch of really important principles. And I think that's the way to think about, at least from my view, today at 5 to 5. That's that's what I think.
Yeah. And Peter, you already noted very practical things that a person can do to support. Can you, and to summarize Anita's comment and question as well, can you provide some tangible way forward next steps that a multilateral institution like World Health Organization can do to really affect institutional change moving forward, especially with the pandemic?
Yeah. I mentioned the review of the international response, including but not limited to the performance of WHO, because let's remember that the actions of countries are very, very important here. But let me pick up actually on what individuals can do. And let's talk about some very practical things. We're going to have to learn to live with the virus. We're going to have to accommodate it until and if there is a vaccine, and that's for the coming months. So we're going to have to wash our hands. We're going to have to not go to work if we're sick. And most importantly, as we ease lockdowns and we get these peaks and valleys of the virus, we're going to have to put the virus in the penalty box. It's the shoe leather epidemiology of finding every case, tracing the contacts, quarantining the contacts, testing. This is at the heart of the response. And this is where I'd like to focus individuals as we think about the coming months. Because those are the ways. That is exactly the way we will be able to accommodate, to live with the virus, to go back to lives which maybe not be exactly like they were before, but they'll be extremely meaningful and enjoyable. And it's all about finding the virus and putting it in a box in the ways that I described until there's a vaccine and as we accommodate and learn to live. And so I did want to bring it back to individuals at the end. And what people can do is actually to follow the advice of public health officials on those types of matters. And we're lucky to have some very good leaders in public health in Canada, including my two friends on the screen here.
Yeah. And Joanne, maybe some final words from you as well in terms of a path forward.
Well, a path forward, I have to get used, because being the head, of MSF, we learn a lot to criticize, sometimes more constructively than others. And then I'm still, developing my skills in bringing, recommendation. And so, but I would just say that I think that in terms of about the structural change for multilateralisms, I think it's important that people feel that they are the owner of the relationship. And if you think you are the owner of the relationship, then that's going to count. And you would want to make sure that your investment is having return on investment and it's doing what it's supposed to do. So for me, I think that's one thing. The other thing, more in terms of the principle, to add to some of what James has said, it's very somehow very simple, but it's to always ensure that we're putting people before politics. And it seems very simple, but it's not always enacted. And we've seen it over and over and over again. And lastly, I think at the individual level, it's for me what's next and how we project ourselves in the future. It's really owning the fact that that we have a common humanity, and COVID-19 is bringing that at the forefront. And so I do hope that at the end of the day, the lesson that will remain with us will be that we have this common humanity, and then because of that, it's important is to make all of us healthier depends on making each of us healthier.
Yeah. Thank you. And I want to firstly thank all three of you so much for providing your time for this conversation. I think you've given myself and the viewers so much to think about, and very tangible things that personally we can do to support, but also things that we can think about and how to move forward in a time when solidarity is very much important and of vital presence to move forward. So Massey Dialogues continues, and next Thursday we have Principal Nathalie Desrosiers, who will host John Ralston and Haroon Siddiqui and Jonah Zaifi on the topic of freedom of expression. And they will continue next week as well. Massey Dialogues takes a team to put together. So I want to take some time to thank Rosemary McCarney, Arya Iliad, Matt Glanfield, who was doing the tech, Abra Rissi, and of course, Nathalie Desrosiers for helping put together such a platform for all of us to come together and discuss something that's very important. And thank you as well for joining in and viewing this great conversation.